thanks very much, everybody, for coming along to this session. My name's Ruth Patterson. I am Chair of the Innovation in Education Group at Council of Deans, and I'm going to introduce you to Dr. Neil Ralph, who is part of NHS England and the Director of Technology Enhanced Learning. I'm sure you're all here because you have got a keen interest in digital technologies, and what we're seeing across the health and social care sector is everything becoming more digital, and that has both opportunities and challenges. And we're going to discuss those today with Neil. But one of the most significant things that's happened in the last couple of years is the publication of the NHS 10-year plan, which has really accelerated that shift, that embedding of artificial intelligence into healthcare, and understanding what that means for both education and the impacts on services. And what we'd like to do in this session is really have a discussion with you all about really how we can examine how healthcare educators can ensure that technology-enabled education doesn't disadvantage those most at risk of being disadvantaged, and sort of ensuring that the inequalities aren't widened and in fact that gap is narrowed. As I said, we're going to look at the opportunities and challenges of digital delivery and highlight those practical strategies for improving access, quality and inclusivity, an absolute core theme throughout all of our programmes in healthcare education and indeed across the university sector. Neil's going to give us a really excellent insight into the emerging national priorities and what they mean for us as designers of curricula and learner support and the wider education ecosystem. Just to let you know that the webinar is being recorded, just to ensure that that this has got a widening, as wide a reach as possible. And I'll just hand over to Neil just to introduce himself and just give a brief introduction. Over to you, Neil.
Thank you ever so much, Ruth, and thank you everyone for joining. It is lovely to be here this afternoon, talking to you from, well, there's a bit of brightness in the sky over East London where I'm sitting today, which is a nice relief. So yes, thank you. Lovely to be here. So Neil Ralph, Deputy Director of Technology Enhanced Learning at NHS England. I am very lucky to have worked for nearly a decade now, looking after a team which has a focus on supporting how we modernise education and training, and really looking at the opportunities of learning technologies and the opportunities of simulation-based education, for instance, and how we can continue support where education happens. And within my portfolio of work, there's a few things that we've got some responsibilities for. Some of that is how we are continuing to deliver some of our live national learning services, e-learning for healthcare being one that's been around for a long time, and how we're developing something called the Learning Hub as a new learning platform for the NHS in England. And connected into that is we've got our own sort of internal industry of creating online learning, e-learning products that are used at scale across the 4 nations, really to support access to learning linked to key areas or national policy and strategy. And we are continuing to discharge on that duty. And then we've also got some real interest, and we work with our policy and our strategy teams, and we work with colleagues such as the Council of Deans in how are we able to support people in the delivery of education. What do we need to think about in terms of competence and capability for our educators? What does good best practice look like? What can we do to support innovation? And there are plenty of areas where the pace of change is moving and increasing and accelerating at a rapid pace of knots, and things like the opportunities around immersive technologies and how that integrates into simulation-based education or into curricular delivery, the focus on placements and addressing the challenges of placement capacity and the integration of simulated approaches into that. And then, of course, the emergence of generative AI and its real world impact on the way people can educate and the way people will learn, or their expectations going forward. So I'm fortunate to be connected into many of those different conversations and looking after a team around all of those areas and connecting into the work around the 10-year health plan. And now what we have, Ruth, coming down the line too, is a 10-year workforce plan, which will put a little bit more meat on the bone in terms of the expectations coming from our ministers, coming from the government on furthermore what they want to see. And how can we enable the 3 shifts that were very much emphasised in the 10-year health plan that are going to have a big effect on everyone involved in the delivery of education for our future workforce, and then the experience of that workforce as they go into their first roles, and how they need to continue to develop as lifelong learners through their career, and hopefully a very long career in the healthcare system. And we can get into those a little bit if you want to, Ruth. I mean, profoundly, the analog to digital shift that you mentioned before, huge ambitions in that space. And I think it was well articulated as some big bets in that space as well, that digital technologies are going to achieve 2 things. One is that they're going to improve access to patients into receiving help in a timely fashion, and support them in as they might need to continue to access different types of help in different ways from the NHS, but also to enable the NHS to or to take the strain of some of the more administrative procedures within the NHS, for instance. And I think there is for sure an ambition in freeing up some more time to care and to be doing the humanistic part of patient care alongside that, as well as improving outcomes. And I think already we're seeing huge ambitions around the use of the NHS app, for instance, and what capabilities can be included within the NHS app as a way of supporting that sort of that first engagement with the NHS. But of course, we're also seeing it with expectations of some big transformative changes, for instance, coming that are going to impact everybody across most roles. If we think about ambient voice technologies and the ability to for artificial intelligence to record consultations, record conversations, and to initiate some of the administrative tasks, that are going to have a big impact on anybody working in a clinical setting. And then the other shifts to think about are going to be things like the continued evolution of genomic medicine. And this is maybe more futuristic, but are we moving towards personalized medicine? And what does that mean in terms of the sort of conversations people now need to be equipped with skills to have? What will that look like? And I suppose, but one that's a little bit closer to home is the big ambitions of moving more care from the acute sector into the community, and the creation of neighbourhood teams, the adoption of wearable technologies and other technologies that you might be having to be confident in handling and using and applying potentially in a community setting. What are the skills and knowledge people need to have with that, and what's that evolving multidisciplinary team going to look like in that space as well? And I think the sort of digital technologies are going to be woven throughout, and a big push to leverage that digital as much as possible. So there's an expectation the future of work in healthcare is going to look increasingly very different to how it looks now.
Yeah, thanks. And I think you've covered a huge amount there, and thanks for that. I suppose I'm already going to go off piste with the questions that I've got, so I'm really sorry about this, but I'm just really interested in some of the concepts that you've sort of discussed here. In terms of healthcare education, obviously I work in a university, and we're trying to keep abreast with what's going on in the NHS with regards to this. What would you say would be the most significant change in terms of this digital revolution that we're going through, that is really going to impact on how we educate our students, or our healthcare students, of the healthcare practitioners of the future?
I think, Ruth, the there is a significant sort of emphasis on those core digital sort of competencies, and there is variation in people's sort of confidence, and in sort of where they're presented with sort of digital tools that they need to use. And that's often quite different to how their confidence may vary between their level of confidence at home and if they're ordering their food from their supermarket, or buying a holiday, compared to actually when they're needing to use some sort of digital tool in their job. And we know that some of these digital tools are not always designed with the user at the center of them. They're
Yes.
typically not as intuitive as some of the things that are built for us as consumers, for retail purposes or banking, etc. So that can often have an impact on people's confidence. So I think one of the things we need to understand is kind of where are people at in terms of their confidence, and we need to make sure that actually growing that professional workplace or education context digital confidence is something everyone's on a journey on, and
Yes.
that we need to make it very easy for people to say, oh, I need to build my confidence in this, and rather than it become as something to be stigmatized. I'm sure it's not, but we don't want people to grow a level
Yeah.
of shame around that they need to ask questions, that they'd need a bit more time. So basic digital skills are very important. I think there is something to, Ruth, in when we're thinking about using these digital tools, what we're dealing with is a new layer of needing to understand the importance of information governance as well,
Yes.
and how we look after that, and the way in which information is handled, and what our individual
Yes.
responsibilities are in that respect too. So I think the sort of pressure in that education environment is about allowing people to grow those skills. I think familiarity with EPRs, for instance, is a challenge in an education environment before people go on placement, and they're sort of at risk of being a bit overwhelmed with what they're confronted by, maybe. And allowing people to sort of have options in way they might sort of hone those skills, but also understanding that shifting context of how we interface with digital in the work environment in a healthcare setting compared to our personal lives.
Yeah, and I think that's a really good point. It is that sort of um, tension between what they're going to see in practice and what they potentially might see in the education environment, and it's how you sort of marry those two together to say this is both an enabler. The digital technology is both an enabler, but it is also something that we need to be cautious about in terms of how people are using it. And I think your point about data and data protection is an important one. I just wondered whether you'd like to expand a little bit on that and your thinking around that.
Yeah, I think if it's um, well, I'll draw upon a little bit of an example, really. I mean, one of the things we've been working on in my team with a number of different colleagues is what are the principles around the adoption of AI, generative AI, ChatGPT, and
Mm-hmm.
Claude, etc., technologies, because we know that they're increasingly becoming a part of people's lived experience. People are using them on a daily basis. However, we need to understand the implications are of that, and so we know people would be sharing personal information into those environments, for instance. And this might be sort of an exaggeration, but it's very easy as these things become so familiar and so much woven into daily experience that we forget how much we can share or not share. Same with social media platforms, for instance. And, so it's understanding that boundary. And I think that fits whether you're at university and you're in your studies, and how you're using these tools too. There's further complications in that in terms of how they can enhance education versus actually be detrimental to that. But and I suppose it was thinking about your question about what it means, the implications for sort of how what we need to educate and what we need to focus on. I think it becomes really complicated. Very quickly for people to know what are they just allowed to do safely. How do we manage? How do we share information? What do permissions look like? Paper-based systems were so much more straightforward. Going into digital systems, either the systems have guardrails around how things work, but sometimes they don't, and people need to just know what's appropriate for them. So it just adds another layer of responsibility onto each person as they're growing to become a registered health professional, and it's something to pick up early rather than I think be challenged by it. They're working.
So in terms of you've sort of touched on some of the key challenges there. What do you think the opportunities are for digital here in the healthcare space?
Well, I think, Ruth, there's absolutely enormous opportunities, and I would say opportunities both in terms of the application of technologies and the way we train and teach and educate people, but enormous opportunities for people to engage with innovation as their students or as they go into work. This is we are at we're a paradigm shift era right now. We're at the tipping point into that fifth industrial revolution, which will have transformative sort of effects on our lives. If we know that this year, I think it's been it looks like if you sort of listen to sort of the technology press, that the big technology companies, the Googles, Microsofts, will spend about $750 billion investing into data centers and AI this year, which is way beyond the GDP of countries like Italy, etc. Or sort of Greece, middle, big countries, some middle income, and that's going to mean these technologies can advance at a pace that is quite phenomenal. So this is a paradigm shift opportunity, and I think there's going to be an enormous amount of opportunity to kind of people to get on board on that. And we want people to come in confidently saying, okay, we'll go with this. We've got to be accustomed to change because the experience of work is going to evolve because new opportunities for technologies to do things is going to come on stream. I think we need to be wanting to, we should all go in with an expectation it's going to be about improving patient care. It's going to be about being able to do a better job. The Health Foundation did a really interesting piece of research recently where they were asking people, I think it was across professions, in clinical professions, if technologies like ambient voice were part of your sort of workplace, and you had, and it maybe helped. What did they anticipate? I suppose how much more time would that free up for them? Let's say it's 10% of their working week, for instance, or working day. What would you do with that time? And some of that was about having more time to be with doing a piece of patient care, for instance, with an individual. Some of it was about being able to just take stock and
Mhm.
have a moment to reflect, and some of it was about being able to do some continuous professional development. So I think there's one of the things we can see from this is not an expectation of we just need to speed up the pace, speed up the flow of patient interactions and patient care through the system, but actually creating a bit of headroom
Yeah.
for people to have a better experience of delivering that care too. What's really important is that as professionals or students going in, and as educators, that should be the expectation we're going in with. Yeah, we can do better outcomes. We can be more efficient in the way that we deliver care. We can do better care because we've got better access to data. We can look after people better. We can do more preventative type stuff
Mhm.
because we know more about people. But
Mhm.
actually, we as members of the workforce or training in it can also have a better experience of doing that too.
Yeah, I think that's so what we're seeing, and some of the research that's been done looking at policy guidance, for example, in our universities, is that this is an opportunity to rethink learning, but there's often a bit of reticence, isn't there, in terms of what's the new business model going to look like? What's this going to look like? What implications is this going to have for me on the ground? And I think it's a really important point to pause, because there's a potential inequality there in terms of what people might have access to. Some people might choose to use some of the technologies, others might not, because for whatever reason, it might be for sustainability reasons, it might be for reasons around knowledge, fear, etc., etc. And I think one of the big leaders of the cloud-based technologies, he'd said it's not that jobs are going to go, it's that the business models are going to change. And I wondered whether you had a view on that at all, from an NHS point of view, because, sorry, my dog's joining in, and because that's an important point, isn't it, to consider, because a lot of people see a real opportunity, but there are a proportion of people who think, "Hmm, this is going to put people out of jobs, or the business models are going to change, and what's that going to look like?" Have you got any view on that from an NHS England point of view?
I think what I can say is I think there's a lot of thinking going on around this. There's there's going to have to be some evolution, and digital technologies are going to be a big driver for that. And so the way in which we educate is already changing transformatively. Really, if we think back to the COVID pandemic and how that led to a big shift, how expectations of also of generations coming through into education, their expectations are also potentially different to a decade
Mm,
before. And so as educators or an education system, that will need to keep
mhm.
evolving. The way in which that's got to work, I think, is, of course, it's got to be sustainable. So evolution and change has got to be practically deliverable, and in a way
Yeah,
that's not going to lead to unintended consequences
yeah,
and be detrimental. I think what we some of the things that are going to be emphasized, we've sort of touched on some of them already. That is that people are going to need to be equipped with different skills for how to learn. So there is an emphasis around lifelong learning. You may do a course and you may be qualified, but you're going to continue to need to learn. You're going to go into
mm,
different settings, and you'll need to be able to adopt. And so there is a lot of thinking around sort of a competency based framing for sort of knowledge, skills, and behaviours that people need, but also what are the capabilities people need to know how to be good learners themselves. And I think that's something that
yeah,
there are some of the sort of modern paradigms, there's sort of andragogy paradigms that that term people are aware of around adult education. terms like hoitagogy around self-determined education, people are being able to take real agency in their learning because they're going to need to do that because the world will evolve around them. I think so that I think is stuff that the education sector and all of us as a system around that will need to get our head around, and what's the return on that investment, I suppose, for universities involved in that. I think that what we also want to make sure is that people are being attracted into, nursing courses for yourself, Ruth, and for instance, and all the different professions. And so the way in which we teach people has got to look good. It's got to feel like I'm getting a really good experience here, much like if I changed my mind and went into some sort of other profession. So we want healthcare to keep up as best as possible with regards to that. And how do we make sure that people are interested in that we can widen participation and do that well. And I think some brilliant work widening participation comes in. We want people to look at the different careers and to know there's ways of accessing those, even though they might have lots of other responsibilities at home or in their personal life. That's childcare or whatever it is, and that we're people are not being excluded from accessing these courses. So the model of delivery, I think, needs to keep moving towards more blended approaches. For instance, more opportunities to maximize the time when students come together with their faculty and to do lots of good problem-based learning, for instance, and really work well together and grow those collaboration communication skills, which those that ability to relate to each other in a complex setting is so fundamentally important, and to be able to do some of that knowledge acquisition at their own time, for instance. But how to maximize that but not also lead to the unintended consequences where people can easily feel a bit isolated as learners too. So there's fine balances to be sort of found in the way that's developed and delivered.
Yeah, and it's all that learning that we've sort of had from the pandemic. Whilst it was a time which was very challenging for a lot of people, we understood that there were some people that, that especially in rural areas in Scotland, their access to healthcare was very limited should they not be able to go to a surgery. And access to medicines, which is my area of research, access to medicines was really problematic. But what COVID has given us is both an enabler in that people are now able to access medicines remotely, prescriptions remotely, which has been a real shift, which was very challenging to implement in the NHS prior to COVID, but now is part of normal practice. I'm going to bring in one of the questions that one of the delegates has asked, which is from Karen Mahoney. Karen Mahoney's asked about, so to address these inequalities, we have to have a sort of synergy and sort of close working relationship with our NHS partners. And the challenge is that trying to get these technologies integrated into an area which is really integral to our students' learning, which is simulation-based learning. Have you got any examples, Neil, of how some of our NHS partners have aligned to universities to ensure that the technologies that are being shown in practice are able to be practiced in the universities?
I think this is it's such a good question. It's such a good question, and I know one that's getting a lot of focus and conversations around. I think there's, and I'm going to struggle on the spot to come up with particular examples of institutions. No, it's fine, but there are some great collaborations around access to electronic patient records, for instance. One area that everyone really needs to have an opportunity to get the basic, ground themselves into some of the core sort of awareness that they need to go with confidence into a placement and to then be able to, under supervision, contribute into EPRs. And I think so that there is some really good examples there. I think some of those things are where people are using some of the easily accessible sort of simulated EPR, or people have built their own versions of that
Yeah,
that can
yeah,
provide some of the basic skills. I would really like, and it's a conversation we've been kicking around with ourselves here, some of our nursing colleagues and HP colleagues, is, well, what could we be doing nationally to help shift that forward,
mm,
really?
yeah,
Um, I'm also aware that, there are some places that where we just have increasingly some absolutely fantastic simulation centres, and there's some really great collaborations becoming between universities and trusts to share some of those resources.
mm,
I think there's a bit more maybe to be done
mm,
in students being able to access some of the simulation opportunities, if you're non-medical, in some of the healthcare settings, to get your hands on some of the equipment. But I'm pleased that I'm seeing a lot more willingness to collaborate over the last few
mm,
years,
mm,
which is going to be so important, because we do need to absolutely expand simulation based placement experiences, for instance, particularly if
yeah,
they then need to shift into community settings,
yeah,
because we really want those students to get as much exposure, don't we, to all the sorts of sort of
yeah,
clinical experiences, that we know is going to help them meet the outcomes they need to meet, and
yeah.
be confident practitioners when they register and qualify.
And that kind of links to both the clinical competencies that we need to develop in our teams, but also tackling those digital inequalities. One of the and sort of thinking about that, there's the training platforms that that need to be developed alongside the live platforms that are being here. But are there any other key considerations that they need to think about as there is this shift to digital, from an NHS England point of view?
Well, I think, I think there are. I mean, I'll say some things from I suppose, bit of the live conversation in NHS England, and then some personal views as well. If that's all right, Ruth. I think uh, we we know that we want people to become good lifelong learners, and one of the things that we would love to be able to do is empower people with a lifelong learning record. Can they start to build up their portfolio of learning, which they may do in their university setting or prior to starting on a course, and then as they move in their first roles, and they're either developing through their own professional development to maintain the registration, or they're acquiring new qualifications as they want to progress through their career and maybe specialize or otherwise. And how are people capturing all of that rich learning that they're doing, and how does learning need to be managed, and in a way of what how do you how do you credential learning, for instance? How do you reward learning? How do you recognize learning? And how do we better recognize some of the learning that happens uh, during work, I guess, as people are extending and growing their competencies? How do we better recognize and reward those in a way that everyone can understand and appreciate? And how do we create passportable sets of skills, for instance? I mean, there's a bit of an example here that we've been doing in supporting some of the colleagues in our London region, and it's just live because I was having a conversation about it today. We've been doing some work with some of the London trusts around IV therapies, and as nurses are moving around, or they're sort of going into the first jobs, they're getting some additional training around delivering IV therapies. And what we saw, what we see at the moment is there's an awful lot of duplication. If people move roles, they are then repeating that training and proving their competence in being able to do that. And actually, how much more time and money can we save if somebody has a recognized training and they may need to further show that to their manager, but actually we could accelerate their ability to do the job that they're there to do, and not wait for a training course to come around. So I think there are many ways that we could really enhance people's ability to learn and create huge efficiencies in the process as well. And so I think lifelong learning records, just going back to your question, actually, otherwise far too much of a tangent. So lifelong learning records and recognizing learning and looking at how learning is sort of sort of credited or credentialed or recognized is going to become key stuff. How do we join up that pre-registration experience with that post-registration experience? That I think is where I'm going to with that bit. A question, because as a system we've got to work through that.
Yeah.
Digital technologies underpin it. And then I think the other thing I was going to say, I suppose, a little bit more of a personal point of view, or looking at the work that people in my team do, the more we're leveraging digital technologies, the more we're leveraging simulation-based approaches, and I think really thinking about how that really integrates into curricular delivery. The more we've got to be thinking about that learning design, the more it's more and more important in terms of how the education is structured, the way in which people are presented with content, the way in which those experiential learning experiences are designed and delivered and connecting to maybe some of the knowledge learning that they've been doing. And so I think it brings lots of huge opportunities, but I think it really will put some pressure, I think, on people needing to have really good sort of educationalist knowledge. And I think it will also mean that people in roles like our simulation technician roles, for instance, are going to be expanding their capabilities, particularly if we're bringing things like virtual reality more and more into the mix there. And I suppose, and I realize I'm saying a lot. The other thing that we need to think about, I think, is affordability too. So if we want to give people a greater opportunity to practice in a safe environment through simulation, in its across the spectrum of simulation, we've got to do that in a way that's actually affordable. So how does that paradigm, for instance, need to or how does that sort of a part of education need to shift in expanding access, but doing it in a way that's affordable and achievable, and probably with not expanding the sort of faculty of people around it as well, which is the other big challenge.
Yeah, and I think that sort of talks a lot to our standards of pre-registration standards in terms of, number one, I think you talked a little bit about that skills passport and that transferability of skills across different board areas. I'm sure if Fiona was here, she would really sort of talk to some of the work that's gone on in Scotland with the skills passport. But I think there's also what strategies do you think we can put in place? We've got increasingly diverse learning needs for our students. They're becoming, the diversity, the cultural changes, the cultural shift in the UK as well. Can you sort of give us an insight into strategies for improving access, quality and inclusivity in the diverse population that we're dealing with as health education professionals, or health professionals, sorry?
Yeah, I think there's probably a few things to pick up on there, but Ruth, what I'd say is it's a challenge everybody's got, and I think it's something everyone is continuing to learn how to best try and overcome, really. One of the things I suppose to consider is that it goes back to the way that we approach designing our learning content or our learning delivery, and how much are we sort of putting accessibility at the forefront of how we approach that design. Now, for instance, where we're creating e-learning that we know is going to be used by tens of thousands or hundreds of thousands, or if it's statutory and mandatory learning, dare I say the phrase, by 1.5 million people employed in the NHS. Accessibility has got to be at the forefront. Otherwise, we're breaking the law, really, in terms of
Yeah.
accessibility rules. But how much are we? How much, when it's not at that sort of scale, are we putting that at the forefront? Because if we're not, we're easily then disadvantaging people. How much are we thinking about the language that we're using in the way we're articulating some sort of learning point? And this is where I think it becomes important to look at those educationalist skills. It's actually, I'm a clinical psychologist, and I still teach on a course. That's my background before I got into this fascinating world of working in national programs and functions in the NHS. And I will also still check with myself, because I will pull some materials together and some exercises when I go off and do little bits of teaching. They still let me do, and my materials. And how often I think to myself, well, I'm articulating that point the way I want to. Am I articulating the way that's going to give everybody the best possible chance to take that learning away, to understand it, to engage with it? So I think we've got to emphasize some of the real sort of key sort of learning design, educational kind of values or approaches or strategies within this. I think the other thing, Ruth, is that um, we want to continue to embrace that diversity. But one of the best ways we can do that is to actually understand. We need to understand what our students' needs are, for instance, or the needs of our employees or the needs of our colleagues. And we need to make sure that we are supporting opportunities for people who may have some needs that are outside of the majority, that their needs can still be met. So we need flexibility in some of the things that we're doing to accommodate people's requirements, and be open to that as a system, as an organization. And digital technologies provide us with some of the opportunities to do that. And I think what would be lovely is seeing us being able to really become more sophisticated in across it, where education and training happens, to either we can give people some of the accessibility tools if there is a particular sort of a requirement there. We could also look at how we provide people with the tools to create or access resources in different ways. And I think, for instance, we already see some people turning content into podcasts and listening to it on a journey, but actually maybe that's the best medium for somebody to be able to engage with some material. How about we do that a little bit more, and we're brave, and we put the right guardrails in place, but we explore that ability to have all different sort of options in terms of engaging with the same topic, leveraging the tools that enable us to do that quickly, because we don't do it before, because it's too laborious. We don't have the time, but actually we could start to explore how we might provide those options. And then, and the other thing is, again, it's not just listening people, but there is brilliant opportunities emerging around sort of learning analytics. How are we spotting where people are interacting with our systems and there's a change in their behaviors because maybe they're struggling a little bit? And I think this is something that I know there's sort of varying degrees of interest in, and it's been around for a little while, but we're increasingly starting to collect in. We can access information about how we're behaving within our digital environments. And I wonder what we could be doing in the future to have systems that go, well, that person hasn't, they used to submit something on time, they're not submitting something on time anymore. So there's a delay here, or they haven't accessed this kind of these modules that we asked everyone to do. And how about we have ways of checking in if we're not already in for those, because it's possible, again, they might be feeling a bit disadvantaged. There might be other things going on that are that they might be struggling with. So a data-rich environment in healthcare is going to be transformative, but a data-rich environment in the education can also be really transformative too.
Yeah. Yeah, and it helps us evolve our programs as well and our learning, doesn't it? So Neil, we've talked a lot. I've asked you some questions, and we've got some questions from the floor, which I thought we should open it up to the floor for the last 10 minutes. What I was just going to do was just read out the questions, and hopefully hopefully you'll not feel too on the spot with those. But there's some great questions in the chat here, so I'm just going to open them out. The first is about the role of professional regulators. We've got curriculums that are designed and validated based on their requirements. When it comes to digital capabilities, how can we enable our regulators to understand what's coming down the tracks for us in terms of digital learning and how that impacts on how we design our programs?
Yeah, it's a great question. I mean, my experience is that the regulators are already, have been putting a lot of thought already in terms of what is the new world order, what does that mean, what is the impact of that, and the collaboration between NHS England or the Department of Health, Social Care, and the regulators is going to be really important in that space. Standards, or the application of standards, is absolutely going to evolve so that it supports education to have the focus that it needs to have to support ultimately producing the professionals with the skills required, and of course they've got a role to make sure the public are safe in that regard. And so I think there's a really important tripartite there between the sort of national bodies and the universities and education sector in terms of supporting you to be able to design curricula that ultimately meets the needs, and that standards. The problem with regulation, of course, is it's unwieldy is probably an unfair term, but it's unwieldy for a reason. It's designed in its own way, in the way it is, for a reason. And so it is very difficult when you've got this paradigm shift we're talking about here to, there's a tension there. But I think there's really good thinking and receptiveness, etc., and there's thinking to be done at the political level in terms of ambitions there.
Yeah.
So I think watch the space. I think, but I would say this is hard. It's hard for a reason, and ultimately the reason is safe patient care at the end of it, which is of course key thing.
It's public protection, isn't it?
Public protection,
yeah. Mike's talked about the sort of lack of emphasis on digital technology in university strategies. I think that's a really pertinent point, because we're just rewriting our strategy to sort of think about the digital world, and he's sort of said academic staff are not directed enough on how digital technology can be used and how they can be influenced in its use. Additionally, in HE and NHS, there's a need to influence line managers to facilitate the use of digital technology. We've found them not pushing forward this agenda enough. So in some ways, you've got, I think what Mike's saying here, you've got a willingness to use technology, but it's not sort of directional within the strategies. But there's also potentially a reticence to use it, or facilitate people to use it in both HE and NHS. Is there anything that you can think of that might support, the adoption in digital strategies?
Yeah, I think there's a key reason why there is such a big emphasis on embracing digital technologies, and that there is a key conversation at the moment around expecting sort of education also to, in care, then education also to adopt digital technologies. So I think partly this is the the government in England and Scotland, etc., setting out an expectation. And then I think it's NHS England, for instance, working with Office for Students and looking, Department for Education to understand what needs to be done to support things moving from a national policy strategy and into practice, into implementation. It's kind of similar to the regulation conversation. And universities and businesses need to understand where what's possible and where the opportunity is, what the return on that investment is going to look like. And I think there is this big bit to make sure that actually that those two things are connected, national strategy. And then I think also, Mike, I think it's also making sure that we've got really good discussion and communication happening, because people who sit in potentially in national policy writing roles really need to understand what it's like on the ground, what's really happening out in organizations, what does it feel like, because it's often very easy to get excited around a table with a grand ambition and think, and which is normally really well intentioned with some really good evidence behind the opportunity, but it's that scale of change has got to be understood as well. So I think the discussions are going to happen because they have to. The world is moving in that direction. What do we all need to connect up as a system to really understand what that change process looks like, what interventions are required, and what can be done within an organization, or what needs to be done to support from outside of an organization, and not letting, one of the things I'm really keen to see is we just don't let it all happen by chance, because we don't really want a situation where there are sort of winners and losers, or in whatever happens, or that parts of the country, for instance, feel left out compared to other parts. So how do we make sure we're avoiding that sort of unfair or unwarranted variation occurring as well?
Yeah, and I think that's a really good point. It sort of leads to the next point that Andy's come up with simulation gives us an opportunity to have equivalence of learning experience with our students. But there's currently an assumption that there's a one-to-one equivalence between simulation and simulated practice learning. What do you think the best platform is to challenge that assumption? Neil, have you got any thoughts on that? Because I think in the expert simulation world, and even in the student world, there's a real thinking that simulation-based activities are often rich and controlled and repeatable, which makes it a richer learning experience. What would you say? Where do you think we could take that conversation?
I think it's a really active, important conversation, and I know Andy's brilliant at advocating and driving that conversation as well. I think that this is the sort of things we need to be thinking about in all our touch points. I think this is a good example of the kind of nitty gritty, really, isn't it? Okay, what does it really mean? What do we need to understand? What do we need to get a position on? So we need to be clear. We need to maybe stop always talking in quite high level about things and go, actually, this is a changing world around us. We need to bottom this out. We need to get some of the clarity and a shared understanding. But Ruth, Andy, the other thing I think is really important is that we need to be as evidence-based as possible in what we're doing here. And it's interesting often just how much evidence there is around how we sort of the current sort of hegemony and how we teach. And sometimes it's just tradition, and there isn't necessarily a lot of evidence comparing one way with another. But as we're moving into a different paradigm, and we're thinking about the parity between clinical experience and simulation-based experience, for instance, people are quite rightly saying, well, prove it. Why? Show me. And that's a good question to ask. So we've got to start to generate the evidence. We've got to sort of test our hypotheses out here. So I think some of this is actually how we doing good enough evaluation and research so that we've got some data to back up our assumptions or to prove to counter misunderstandings as well, and that evidence is also being surfaced in the forums that it needs to be to drive decision making.
I think Shan's got a very good example. She's given us a very good example of the partnership that she's got with a company that has a contract with 15 different partners that have installed some tech into homes. And it's a really good example of how the digital technology that's being delivered in healthcare has come into the university because they've equipped a flat with a range of tech that they can simulate that digital home, which is a great example, which perhaps speaks to our point about, how we can integrate the two, both the theory or the HEI work and the NHS work. And what she said here is speaks to your data side of things as well. The data collected from the 35,000 installations has potential for use in useful research in a data lake, which is a really excellent example, isn't it, of how technology has been used in that partnership working between the HEI and the hospitals or the health boards is really helping. Have you any comments on that technology?
Yeah, well, I think that is an absolutely fabulous example, and I really appreciate it being shared. And it's making me think that one of the things that is another conversation here is when we're going out and often spending huge sums of money on these technologies and bringing these innovations in, we can do better at extracting some social good. And companies are often open to that. They just maybe don't know it's an option or haven't thought of it. We're buying the service from you. What we would like is access for education and training to this technology. And so how can we use leverage contracts with some of these digital providers for these kind of partnerships? That's going to become more and more important. And it is a bit of a conversation going on and tapping into in NHS England, which is good too. And I think, we should all be, pushing for that because it's to the benefit of these solution providers, these tech companies, and typically doesn't they already have some sort of social kind of impact stuff that they're trying to achieve for shareholders, for instance, and we can provide all sorts of opportunities for them to do that if we're bold enough to ask.
And it's simple things like giving our students access to some of the platforms, some of the training platforms, and because they don't have an NHS address, it's often very difficult for them to access that or to access some of the technology to test out. And it's perhaps that more partnership working at that strategic level that's needed to happen. So, as you say, once a contract comes in, perhaps integral to that contract is to ensure that our student population or our learner population has access to that.
I think that's it. And actually managing identities is a really good point. And something we need to do better at. And I know in England, one of the things that's being looked at is a sort of a national single identity and how to make sure that students and trainees coming in have their have their own identity to get into all the systems that they need to get into in a sort of frictionless way. So yeah, managing that and doing that better is definitely something that we should be expecting.
Absolutely. And I think Sean said it as well. The health tech companies actually benefit from the students accessing this technology because they come in better prepared. I think it really sort of speaks to that, tackling those digital inequalities as well and allowing people the test beds in a safe environment rather than going into an environment cold and not necessarily being able to access these technologies. So I think that is perhaps a key that needs to be unlocked nationally. I don't know what you think about
that. I do agree, and I say I think there are some really good sort of conversations and discussions around that sort of thing happening. I think that, but I think again it should be part of the discussion. If we want this, if we want people to feel confident and capable around having to work with some of these digital platforms or digital technologies, how can we give them easy access to that. And what we can't be doing is buying a solution for every organization or for every type of technology and in every setting. It's just not going to be possible. So no, we need to use our kind of economies of scale to our benefit in that regard.
So Neil, it's been a fascinating conversation, and thank you so much. But we've run out of time, and I don't want us to get cut off before we say a massive thank you to you all and a virtual round of applause, because it's just been a really interesting conversation. I also wanted to thank the attendees for joining. Absolutely fantastic to have real insights into the work that you're doing with digital technology. And one of the themes that I think I've got from this is really this integration that we need to really think about in terms of the integration between HEIs and healthcare practices to ensure that the digital equalities are minimised and to make sure that people have access to these digital technologies, both in the learning environment and also in the workplace. And it's how we work together to do that. Thank you all for joining this webinar. Please access some of the other Innovation Month webinars that we've got going and the resources. And we're going to be sharing new resources throughout the rest of the month. So thank you very much. And I hope everybody has a very good afternoon.